Good evening. This is Dr. Bill Wyatt again with the American Orthodontic Society, and I've been talking about these blonded blocks you put on teeth, and they help out, but in some of the cases it takes more than the bonded block to solve the problem. And this is a difficult case here that I want to show you, and I feel like this kind of stuff ought to be taught in the universities and let the general dentist, the pediatric dentist do the simple things, but that's not the way it seems to go. So anyway, let's take a look at this gentleman, a very nice fella, and I hope we helped him some, but I'm not. I'm not sure you couldn't do it better some other way, and hopefully nowadays they can, but they'd probably take his face apart surgically and everything to do it. Now, when you look at it here, this is 1990, and he's about 49, I think, years old, something like that. He's got a deep bite. I mean, it's really deep. I mean, you can see the lower front teeth across here just a little bit, but not much. Not only is it deep, but it's off to one side, and so it's going to be a problem to rotate the arch and get the teeth together properly. But anyway, that's what we're going to try to do. Looking at it from this side, you can see the lower arch is in pretty bad shape. It's got a molar tilted over there. I think if I was doing it now, I would try to upright that molar completely before I started, but we uprighted it some, but not completely. On the left side, now we have no posterior teeth at all, and you're going to try to do this with no teeth, and that makes it difficult as all get out. And we made it's a partial out of blocks of acrylic, with a wire holding them together to work on the lower teeth. Now, if you look at the curvature in the uh, center of the upper teeth, it goes kind of like this, and you're going to try to straighten it out, but we couldn't do it completely, and not in the way that I went about it anyway. Now here the lower teeth, I think this is after we kind of straightened them up some, but there's the little temporary partial we've made. See, just a big wire going back here with a clasp on it, and we had a wire in there with the teeth setting on it, just a kind of a temporary type partial, so we could put something under those teeth. You have to get something under them to level the bite out. And so here's the way it looked in 1990, looking from the back of the arch down here. And you see the lower teeth are almost up to the roof of the mouth right in here. And so we're going to have to level this out as far as we could before we started with. And we're in a class 2 situation. This cuspid needs to go in that spot right there, and we some way or another got it in there with elastics and everything. Over on the other side of class 2 also, the red spot should go over the blue spot there. And here is the Panorex, and starting in 1990, this was number 1 Panorex, and he's age 49 and 2 months, and this is 11/1/13 of 90. And you can see the tooth is really leaning over, and we didn't straighten it up properly in here. It had no teeth in this part. Now, a lot of people would put implants back in here, and that might be better way. It'd be a lot more expensive to do that. And I don't know whether that was a part of the problem or not, but now the upper teeth come down to there and the lower teeth go up to here somewhere. Just showing you how deep it is. This having a bite tool on a Panorex to do that. Now here we bonded some blocks on the anterior part of the mouth and was trying to open the bite. We didn't even have these closed. So we're trying to pick this up and it's pushing this down at the same time. And we're trying to do a little bit of that on the bottom, having a bite on this block on the bottom arch down here. And from the side, you see we got some elastics coming in here, but this is an intruding arch which goes up here, and we pull it down and pick it over there, so it's picking these teeth up, and it's pushing down on these molars over here. They don't have anything underneath them right there, so we gain a little vertical dimension. That way we open the bite skeleton in that method. Okay, this is 1993, and I'm sure we're scratching our heads to figure out exactly what the best way to do this. This 50-year-old man, and anyway, so we built this little temporary partial. This is just a wire we got in here, and we put clasp on it and everything. It's got pads of acrylic in here that butt up against the teeth, and trying to level that arch out that way. This is the way we bit on the, I think that's the lower anterior. Oh, that's the lower anterior right there. Okay. Here with the arch wires we bent up in here and came across and dropped it, and dropped the lower anterior teeth down in relation to the upper cuspids and everything. Now here it is in 1993. We've got it open pretty good, and we're rotating some of those teeth with these little plastic deals like that. And we're opening the case more than normal, so it's 93 something. We've been in there about a couple of years, pretty close here. Now the class 2 part that was over here, we got it over there in the class 1 relation now, and then we're going to have to build something permanent on the bottom down here. And this is the upper. We're putting in a kind of an upper retainer with the inner part of that, and letting them bite into this part right here to help level out the bite. And there's that partial again that we made, and this is the first cephalometric picture we take of him, and this is the first Panorex, and you'll see that he had a kind of a partial in there when we started, and we may have added to that partial. Now he's age 50 and 9 months at this point. And here's the way he started right there with class 2, and we got this into a class 1 relation now, right over there, and the midline is pretty well lined up, and you got the class 1 over on the right side of the mouth also. And that's the 90, the way it was, a deep bite, and we've opened the bite and leveled the arch, and it was a chore to do, but we got it done, and I hope you can learn something from this. He's wearing his retainer. You see this little groove in there, that thing stays up in his mouth, and he's staying with it good, thank goodness. And there is the retainer, and this is 96, and it's holding good. That was 90, and that's 96, and this is the bottom part. Now you'll notice on the finished partial we had the lab make, well, his dentist had the lab made this deal down here on the bottom that just kind of wraps around the teeth, and that keeps these in line and everything when you do a case like this. So that's not a bad thing to use. It's just wrapping those teeth with the metal and on the bottom. So anyway, there it is, a little closer look at that holds them in place. It's like a lower retainer that just fits in there. And here is the gentleman, and I think that's the last picture. So we appreciate you watching this, and hope you'll join our group and subscribe to our channel. And thank you again, and maybe you get something out of this. Doing this tough orthodontic stuff, you really learn how to do things. And if you try to teach it to somebody else, you even learn more. So I'm going to pass this on and say goodbye, and hope to see you again now.